and welcome to Mealnote. In this video, we're going to talk about signs and symptoms of fatty liver reverse. Before starting this video, like this video and subscribe to our channel for future updates. Your liver is a vital organ that plays an important role in maintaining your overall health. The gallbladder creates bile, which is an essential component in digestion, builds up the body's supply of proteins, iron that is stored, transforms the nutrients into usable energy, produces substances that aid in the clotting of your blood, sticks together to heal wounds, assist in the prevention of infections by stimulating the production of immune factors, and cleansing the blood of bacteria and toxins, substances that are harmful to the body. What exactly is the disease known as fatty liver? Steatosis, also known as fatty liver disease, is a common condition that can be brought on by having an abnormal accumulation of fat in the liver. A normal amount of fat is found in the liver that is in good health. When the amount of fat in your liver reaches between 5 and 10% of its total weight, you will have a problem. Why is fatty liver disease such a serious condition? The majority of people who have fatty liver disease do not experience any serious complication as a result of their condition, and their liver continues to function normally. However, fatty liver disease can become significantly worse over time from anywhere from 7% to 30% of people who have it. It develops through 3 stages, which are as follows. Your liver will swell up and become inflamed, which will cause tissue damage to the organ. Steatohepatitis is the name given to this stage. Scar tissue develops in the areas of your liver that have been damaged. This condition is referred to as fibrosis. Scar tissue develops to an extensive degree, ultimately replacing healthy tissues. At this point, cirrhosis of the liver has developed into you. Cirrhosis of the liver is an illness. The condition known as cirrhosis of the liver is brought on by extensive damage to the organ. The functioning of the liver is slowed down because of the dense scar tissue that has replaced the healthy liver tissue. Over time, it can completely impede the function of the liver. Cirrhosis is a condition that can result in liver failure as well as liver cancer. What are the various forms of diseases that can affect the fatty liver? Fatty liver disease can take either of these 2 primary forms. Alcohol-related cirrhosis of the liver. The accumulation of fat in the liver as a consequence of excessive drinking is referred to as alcoholic fatty liver. The American Medical Association recommends that women limit themselves to 1 drink per day, while men can have up to 2 drinks per day. This particular form of liver disease affects approximately 5% of the population in the United States. Fatty liver disease not caused by alcohol consumption. People who don't consume large amounts of alcohol can develop a condition called non-alcoholic fatty liver disease, NAFLD. In the United States, the condition affects 1 in 3 adults and 1 in 10 children. Researchers have not yet zeroed in on the precise reason behind the development of non-alcoholic fatty liver disease. There are a number of things that can put you at an increased risk, such as being overweight or having diabetes. Who is at risk for developing fatty liver disease? If any of the following apply to you, you have a higher risk of developing fatty liver disease. Are of Asian or Hispanic descent, or a postmenopausal woman, a woman whose periods have stopped. Have both obesity and a significant amount of abdominal fat. Have a chronic condition such as diabetes, high blood pressure, or high cholesterol. Have obstructive sleep apnea, a blocked airway that causes breathing to stop and start during sleep. What are the factors that lead to fatty liver disease? Fatty liver disease can occur in individuals who do not have any risk factors or risk factors at all. However, the presence of the following risk factors makes it more likely that you will develop it. Being obese or overweight, having diabetes type 2 or insulin resistance in a condition, having metabolic syndrome, insulin resistance, high blood pressure, high cholesterol and high triglyceride levels, taking particular over-the-counter or prescribed medications such as amiodarone, diltiazem, tamoxifen, or steroids can increase your risk of developing a heart rhythm disorder. What signs and symptoms are associated with fatty liver disease? Fatty liver disease is characterized by the absence of symptoms in its sufferers until the disease has advanced to cirrhosis of the liver. If you do have symptoms, some of them could be as follows. Pain in the upper right quadrant of the abdomen, along with a sensation of fullness in that area, belly. Symptoms such as feeling sick, losing your appetite, or losing your weight. Persons with yellowish skin or eyes that are white. Bloating of the stomach and the legs, edema. Extreme fatigue or mental haziness may be present. Weakness. How exactly does one go about diagnosing fatty liver disease? Because fatty liver disease frequently has no symptoms, it's possible that your physician will be the first person to notice it. It's possible that a red flag will be raised if a blood test for another condition reveals higher than normal levels of liver enzymes, also known as elevated liver enzymes. The presence of the elevated liver enzymes is an indication that your liver has been damaged. In order to arrive at a diagnosis, your doctor may order the following. To obtain a picture of the liver, a sonogram or a computed tomography CT scan may be performed. Biopsy tissue sample of the liver to determine how far along the progression of liver disease the patient is. The fiber scan is a specialized form of ultrasound that can be sometimes used in place of a liver biopsy in order to determine the amount of scar tissue and fat in the liver. What kind of treatment is there for fatty liver disease? Instead, the focus of the medical care is on assisting patients in managing risk factors associating with the condition. They also suggest making changes to your lifestyle that can have a significant positive impact on your overall health. The treatment consists of avoiding alcohol, dropping some pounds, managing conditions such as diabetes, high cholesterol, triglyceride through the use of medication, fat in the blood. In certain situations, it may be beneficial to take the vitamin E as well as thiazolidinediones, a class of diabetes medications that include Actose and Avandia. What steps can be taken to ward off fatty liver disease? The best way to prevent fatty liver disease is to engage in behaviors that contribute to maintaining overall health, including the following. Maintain an appropriate body weight. If you are overweight or obese, losing weight should be a slow and steady process. Exercise regularly. Limit your alcohol consumption. Medications should be taken exactly as directed. Is it possible to reverse the effects of fatty liver disease? The liver possesses a remarkable capacity for mending its own damage. It's possible to reverse the early stages of liver damage and reduce liver fat and inflammation if you lose weight and refrain from drinking alcohol. Will having fatty liver disease eventually lead to death? The majority of the people affected by fatty liver disease do not experience significant symptoms. However, if it progresses into cirrhosis of the liver, it can turn into a more serious problem. Cirrhosis of the liver. Cirrhosis of the liver. Cirrhosis of the liver, if left untreated, will inevitably result in either liver failure or liver cancer. Your liver is an organ that's essential to your survival. What is a healthy diet for someone with a fatty liver? If you want to lose weight in a controlled manner, a balanced diet is the way to go. Fatty liver disease can actually become worse as a result of the rapid weight loss. The Mediterranean diet, which is high in vegetables, fruits, and healthy fats, is frequently recommended by the medical professionals. Consult your primary care physician or a nutritionalist for guidance on weight loss methods that are safe and effective. Fatty liver disease should be regarded as an early warning sign that can assist you in preventing more serious liver conditions, such as cirrhosis or liver cancer. Even if you don't have any symptoms or problems with your liver function at this point, it's still important to take steps to stop or reverse fatty liver disease, because it can have serious consequences. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit the subscribe button before you go.